We're very happy to welcome one of our most popular experts here at CFUN. His impressive resume includes heading up the Faculty of Child Psychology at the University of Ottawa, prior to lecturing in psychiatry at Harvard for 7 years before moving here to Vancouver. Most recently, he's become one of the leaders in North America in the field of biofeedback and neurotherapy, which is the medical science of adjusting brainwaves. And we'll go into great detail on that a little bit later on in the show. In fact, many callers to our program refer to Dr. Swingle as a miracle worker, and lots of those are fellow doctors as well. Very happy to have him in Vancouver and answering your questions today. It's Dr. Paul Swingle, and this is It's All in Your Head. Last time you were here, we learned an awful lot about trauma and post-traumatic stress disorder, and we want to talk a little bit today about how that impacts children. And as you've noted with these list of books, it's a huge area.
It's an extremely important area, and the implications associated with child development, learning, and so forth are extremely important. As we discussed earlier off air, I just went through the list of books on the impact of child trauma in one of the local bookshops. There are 118 books written specifically on this topic that they have listed, not counting the specific symptoms associated with trauma like self-mutilation, violence, personality disorders, and so forth.
So it's a huge area, but of course, we're not limited to just this topic. You can ask Dr. Swingle if any brain-related issues are treatable, and many of them are with this miracle of neurotherapy. I don't know if a lot of people are familiar with it. I certainly wasn't until I met you. Just before we get into the topic at hand, what exactly is neurotherapy and biofeedback?
Neurotherapy refers to methods that we use to normalize brain function. The brain produces electrical activity when it's functioning, and what we do is we look around at various points in the brain to see if there are areas of inefficiency. The measurement that we use, as I said, is the electrical activity coming from the brain, referred to as brain waves, and the method used to measure it is electroencephalography, the EEG. People are most familiar with that term. If we find areas of inefficiency in the way the brain is operating, then we do neurotherapy to correct that. There are several different types of neurotherapy. One is brainwave biofeedback, which many people are familiar with. Basically, we set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the computer screen, and it's telling you about an activity you couldn't possibly feel, but you make use of that information to learn how to self-regulate. If it's a child, we set it up so that they play a video game with their brain or make electric trains move around the track with their brain, that sort of thing. There are other procedures that we use, brain driving procedures, for example, and the purpose is to nudge the brain into more normative functioning. We also do optimal or peak performance training. After the brain's been normalized, we can increase the efficiency. Most professional athletes do neurotherapy. It just makes their game a lot sharper.
It doesn't hurt, I can tell you that. It's very relaxing. It starts with what is called brain mapping. So the first thing that would happen is you'd visit Dr. Swingle's office. By the way, it's Swingle and Associates on Melville Street in Cole Harbour. You'd sit down for an initial assessment, and you would hook them up and look at different points in their brain, and you would then tell them why they're there to visit.
That's right. We don't ask people why they come to see us. We tell them why they're there. The brain is that specific in terms of information. With regard to the topic that we're dealing with today, you can see trauma on the brain map. So when we do a brain assessment, there are very specific areas that are impacted by psychological, that is the emotional impact of trauma. And when we see that in children, of course, all the red flags go up.
And then after that occurs, you would probably talk to the parents?
Oh, yes, very decidedly so. If we see a trauma signature, then we discuss with the parents what the potential source of that is. Unfortunately, parents very often are very poor judges of what is traumatic for a child, or they may not know. Bullying is a very good example of a condition in which a parent may not be aware of the extent and the traumatizing impact of the bullying that takes place in school. Surgical procedures, a child may have been terribly frightened by a hospital visit, for example, and the parent feels that it's over and the child is dealing with it adequately, that sort of thing. But the brain is carrying the signature.
And a lot of times, well, you had a great example of somebody that came in not so long ago that showed a trauma signal. Then through probing, you found out there was, a serious family situation that was affecting the child.
Yes, this was the death of somebody that had occurred several weeks previously, and the parent apparently forgot or thought that the child was dealing with it adequately. I think the parent misunderstood the impact that this death had on the child.
So what are some of the things that happen to a young person when they are suffering from trauma? Like, what are some of the symptoms that we know something's not right, like why the parents would come to Swingle and Associates in the first place?
There are several things that can occur. Trauma in a child, when we see the trauma signature, that deficiency in brain functioning is associated with poor short-term memory, poor recollection of things, very inefficient transfer of information to the working memory registers. So very often these children are sent in to be assessed for a learning disorder, and it turns out that it's a trauma. Now, there's a physiological effect of the trauma, which is the one I just mentioned, in which there's a particular area of the brain that's not functioning efficiently. So from a physiological or neurological perspective, the child is experiencing neurological difficulties in terms of processing information. If we look at the psychological aspect of that, if the child has been traumatized and is fearful, of course they're highly distractible. They may be in a unpleasant mind-wandering state in which they're being vigilant or concerned about their well-being or their safety or actually thinking about the trauma. And of course, under those conditions, the teacher is very likely to think that the child is inattentive. We get a fair number of kids coming in with diagnosis of ADD or ADHD, and it turns out that we're dealing with trauma, and none of the typical ADD neurological patterns show themselves on the brain assessment.
The good news is that it's treatable and fixable, and even better yet, it's permanently treatable and fixable, and there's no medication involved, and it depends on the individual how many sessions they need to see you?
Yes, there are a lot of factors here. Time since trauma, the severity of the trauma, what kind of genetic predisposition did the child have to being impacted by the trauma, a lot of things of that nature. For example, a lot of children have a predisposition to being impacted by trauma. Where I discovered that was working with combat and police officers who had been traumatized. This was in the Boston area when I was at Harvard Medical School. It turns out that a lot of them have a severe deficiency in one part of the brain that's associated with stress tolerance, being able to cope with stress. Now, there's an interesting study that was done by Dr. Adams, among other people, that was published in the Archives of General Psychiatry last year, in which they looked at the heart rate of children that were brought into emergency rooms and those that subsequently developed some of the characteristics of post-traumatic stress disorder. And it was very clear. Children who had higher standing heart rates were far more likely, in fact, the ratio was 2.5 to 1, far more likely to develop the symptoms associated with post-traumatic stress disorder than those children whose heart rates were lower. Now, heart rate is a predisposing variable, and that's associated with stress tolerance. That's basically, there's a physiological predisposition to being impacted by the trauma.
We're talking with Dr. Paul Swingle from Swingle and Associates. This is CFUN 1410 AM and Experts on Call. When it comes to kids and dealing with things like death, you gave us a very valuable tip last week when it comes to dealing with trauma, and that a lot of grief counselors nowadays are talking about, instead of reliving the event over and over again, talking about what you're going to do in the future. How should parents approach death with their children, just from a psychologist standpoint? How should they approach death with their kids?
The suggestion that most people have is whatever your spiritual or religious metaphor is, that's the way you address discussing some of these issues. You're quite right. One of the things that trauma counselors have learned over the last few years is that you don't get the person to relive the trauma. That was our old notion. You had to relive it and go through all the pain and crying and all the rest of it. Turns out that that actually makes things worse, not better. Now, talking with a parent about death, for example, if your religious orientation, your spiritual orientation is reincarnation, for example, in one of its many spiritual themes, then that's the way you address it with the child, that it is our belief. And I stress that our belief is that when you die, these are the kinds of things that you can expect. The reason I stress belief is so that the child develops a tolerance for other people's beliefs, so that we don't get into this situation, if you don't believe what I believe, I'm going to shoot you kind of nonsense that's going on at the present time. If your spiritual belief is more in the context of Christianity, then in terms of the resurrection metaphor of what the Christian belief is in terms of what's going to happen when you die, in terms of resurrection and life ever after, and the context in which that takes place. But again, this is our belief system. This is what you can expect. And there is a group of individuals that really propose the spiritual notion that what you believe it will happen will happen.
And just a quick reminder that Swingle and Associates is located downtown on Melville Street in Cole Harbour. And if you would like to make an appointment, the telephone number at the office is 604-608-0444. The clinic number again, 604-608-0444. And you can find out more on Dr. Swingle's website. Very easy, drswingle.com. And Swingle is swing, L-E, drswingle.com. Let's go to Julie, who's patiently waiting to talk about depression. Julie, thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head on CFUN 1410 AM.
Does your type of treatment at your clinic help with clinical depression?
Yes, neurotherapy is treatment of choice for most forms of depression. What kind of depressive symptoms do you have?
It's not actually morphine. There's a lack of production of serotonin.
Julie, we're just gonna have to put you on hold because your line is not very clear. But I think she mentioned, what's the word for
serotonin?
Serotonin. That's it. Yeah.
Neurotherapy is a very effective treatment for various forms of depression. When we do a brain assessment, we can see various brain inefficiencies that are related to different expressions of depression. And it all depends on what type you're dealing with. The rule of thumb is you find out where the areas of inefficiency are, and then you normalize them. In addition to correcting the neurology of it, there's always a psychological aspect associated with this. People develop methods of coping with depression, for example, and we would offer some counseling or some other psychological treatment to help the person redefine how they view these things. They're not fighting the neurology of it any longer. We correct that. It's one of the reasons why it's very important when you're looking for somebody to do the neurotherapy that you don't get involved with one of these one-size-fits-all folks that are sprouting up around. You want somebody that is a licensed professional to practice some healthcare profession like psychology or medicine, for example.
You have a lot of patients that come in because of depression.
Huge number.
Let's go to Cheryl. Cheryl, thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head and CFUN 1410 AM.
Hi.
Hello.
I have a 9-year-old boy.
Yes.
And he's been listed as attention deficit disorder, but he also, about every 13 seconds throughout the evening, constantly has what they term a tic, where he clears his throat, and to the point where it's making it very sore, and he's been doing it for years. And I wondered if there's any concern about that.
Yes. The question is, what are we dealing with here? Are we dealing with a tic? Are we dealing with a seizure? Are we dealing with Tourette's? There are a lot of possibilities here.
I saw a show the other night, and that's why it concerned me, where Tourette's syndrome, they showed a boy, as he got older, he had been clearing his throat, and he ended up with Tourette's. So it just made me wonder about it.
Yes. We treat a lot of children with Tourette's. There's a particular area in the brain associated with some of these involuntary body movements. The major issue here would be to have a look at what the brain is telling us in terms of not only the ADD, and there are many, many forms of ADD that we find when doing a brain assessment, so that we're treating the right type of ADD. And then subsequent to that, what areas of inefficiency we're dealing with that might be associated with this involuntary tic behavior.
He's always had a problem with learning his speech. He's very slow on speech.
Speech?
Yeah, he's 10 in the summer, but instead of saying things like, what time is it, he says, what time it is. And he also says F for TH, like birthday is birthday.
Okay.
He can't seem to remember to put a TH there.
Neurotherapy, particularly the form referred to as brain driving, can be extraordinarily effective for this. The kind of condition that you're describing is almost always associated with inefficiencies in the prefrontal cortex, frontal part of the brain. And what we do is normalize that and then set it up so that we stimulate the area of the brain responsible for the activity, like articulation, for example, while the child is engaged in that task. It's a very efficient system.
Cheryl, thank you very much for calling. And if you want to hang on, I'll just give you the telephone number here for Dr. Swingle's clinic. It's 604-608-0444, 608-0444. He's had a lot of success, obviously, with cases just like yours, and we thank you for sharing your story there, Cheryl.
Okay, thanks.
It must be awfully nice to offer people hope when they don't really know what else to turn to, and especially when the prognosis is always, well, take medication.
There are two groups of clients that really are a joy. One, of course, children. We make a huge difference in their life when you correct something like ADD. I think on one of my very early broadcasts, I shared the letter of a mother who talked about her young child playing a solo on her violin in a brand new school, and she wasn't even nervous about it after we had treated her. Basically, we corrected self-esteem. The other are the elderly who come in heavily medicated and feel that they're losing their memory and Alzheimer's and all that sort of stuff. Get rid of the medications that are causing a lot of these things and brighten up the brain a bit. The eyes just light up. You know, their lives have changed.
You're listening to Dr. Paul Swingle from Swingle & Associates. Let's take another call here. This time it's Donna. Hello, Donna. Thanks for waiting. You're on with Dr. Swingle on CFUN 1410 AM.
Hi, Dr. Swingle.
Hi.
My problem is I have chronic fatigue and fibromyalgia syndrome, and it's been trying on me, and it's very stressful, and I ended up where I just couldn't work anymore.
Yes.
You know, I'm very stressed out because of that, and the factor that you can't work, you can't get money and stuff to live. So when you go to the doctors, they think that you're stressed out or you're depressed, and they want to give you a pill, and I can't take the pills because they make me very, very depressed and suicidal. So I'm thinking I do have a very big stress factor, and I'm dealing with a lot in my life, but the pills aren't the answer.
Has anybody told you it's all in your head?
Oh, many times, I think, yes. And it's just
that's the actual subtitle of this radio broadcast, That's All in Your Head. Mm-hmm. Yeah, of course. Where else would it be?
And it's extremely, extremely stressful.
Yes.
And
trauma is implicated in almost all fibromyalgia situations.
I had 2 bad car accidents, 2 bad head injuries, and one in the frontal lobe in my forehead and one on the side of my head.
Yes.
And 2 bad car accidents, and I don't know if that's part of my problem, or sometimes I think maybe I have some brain damage because the brain fog is so bad, and I don't know if it's being dealt with, or perhaps they say there's nothing they can do. And
no, that's nonsense.
It's just too hard on me.
There's a lot of things that we can do for fibromyalgia. We have a large group of folks with fibromyalgia. There are 3 contributing factors to fibromyalgia. One is head injury, the type that you described. The second is viral infection, and the third is emotional trauma. Usually there's a combination of a couple of those things.
Yes.
People complain of chronic fatigue, fibrofog, which is what you were just complaining about, where you can't think clearly, and pain that very often moves around, so your sleep is disturbed, and it just gets worse and worse and worse. Medicating it doesn't really help the problem. Basically, what we have to do is normalize the brain activity associated with this condition. Our success rate is really quite good. The other thing that we often recommend is a blend of herbs and so forth for enhancing sleep. It's referred to as Silert, S-I-L-E-R-T. That often helps with sleep recovery, and if you can get better quality sleep, of course, that will help improve the situation, and then do some neurotherapy to correct the brain activity associated with this condition.
Don, I can't thank you enough for sharing your story. Does it give you a little bit of hope that you know that this can be dealt with?
Yes, is there a number I can call?
Yeah, let me give it to you right now. It's 604-608-0444. That's 608-0444. And if you have a computer, drswingle.com has also all the details for you.
Okay, thank you very much.
Can't thank you enough for calling. There's a great example of somebody who may have some hope after suffering for quite some time. And you get that all the time, don't you?
We sure do.
That's why you're here. Dr. Swingle joining us on It's All in Your Head. Our focus today is on childhood trauma, but we're happy to take any call. This is Experts on Call on CFUN 1410 AM. I'm your host, Peter Shadd, along with Dr. Paul Swingle from Swingle & Associates. Our subtopic, which is childhood trauma, we've had a lot of great questions so far, and we'd like to keep those questions coming. Jennifer is on the line. Jennifer, thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
I have a question about what you can do in terms of addiction to drugs, if you can help that.
What drug?
Crystal meth.
Yes, we treat a lot of addiction. Everything from alcohol, heroin, crystal meth, and the worst of all, cigarettes.
Right.
There are a number of things that we do. The first thing is we have a look at the brain and look at two things. One is there a genetic predisposition to this condition? And in addiction, usually there's a deficiency in the back of the brain that we can correct so that you're not fighting the neurological predisposition to addiction. The second is to look at some of the psychological issues. The use of most drugs is a desire to escape and to have a look at whether there's any trauma history there, whether it's showing up in the brain and so forth. And the third is to do some behavioral work with the person to help them deal with the cravings. The cravings usually take there's a periodicity associated with it, and it varies depending upon whether it's alcohol, crystal meth, heroin, and so forth. These periods of intense craving hit at different times. And we have a number of things that we can prescribe for home use, things like cranial stimulators, harmonic sounds, things of that nature that offer some help in terms of self-regulation to deal with getting over the craving. Are you involved in any 12-step program?
No, I'm not.
They can be extremely helpful. Some of the AA groups are extremely good, but if this is crystal meth only, it would be a NA group, and they vary in quality. Some of them are really superb, and some of them not good at all. So there's an element of having to make the right choice when you're involved in this. The answer to your question is yes, neurotherapy can help a lot, and the other things that we bring to the table in terms of being registered psychologists, there's a lot of things that we can do to help. The other thing is to have a look at whether the crystal meth has caused any damage, and to correct that. Crystal meth can affect the frontal lobes in terms of learning, memory, cognitive processing, and so forth.
And can you find out the amount of damage that it's done from your test?
Yeah, we can see if there's any damage, and a lot of that is correctable, by the way. However, the longer and the more use we have, the harder it is to correct these conditions.
Right. And what would be the approximate cost?
The intake assessment is $180. And then subsequent treatments average about $100 each. They are covered by extended medical, whatever your extended medical plan is, because we are registered psychologists. And anything that's not covered under extended medical is a tax-deductible medical expense. Now, in terms of how many visits you need, all of that depends on how severe the case, how long you've been addicted, what kind of support you have, whether you are on any other medication. Medication, by the way, is the worst possible route to take for trying to deal with an addiction. You're substituting one for another.
I hope we've given you some hope here, and really appreciate you calling and sharing your story.
Thank you.
Is there any one drug that's more difficult to treat than another these days?
Cigarettes.
Is that right?
Oh, that's a horrible addiction. We treat a lot of folks that are addicted to nicotine. You know, if you look at it at an individual level, the most difficult drug to treat is the one you're addicted to. That's why when we look at these things globally, alcohol can be very difficult for some individuals. Others, we do a few treatments and they're pretty good almost immediately after that.
Well, it's interesting. When I was in, I asked one of the technicians, and she said that you've had heroin addicts come in that were treated, and in pretty short time. It really is amazing, but it's also, I guess, very individual too.
And one of the things we make clear to people is change takes effort. This is no magic bullet. You're going to have to do some things, change your lifestyle. There's an old saying that we have, we can't keep you sober on a bar stool. If your habit is to go in every night at 5 to 9 o'clock with your cronies at the bar drinking beer, you're going to have to change that lifestyle. You're going to have to do something else, because you're not going to go in there, sit on the bar stool and drink iced tea. You're just not going to do it.
You're talking and listening to Dr. Paul Swingle from Swingle and Associates here on Experts on Call. The number at the clinic again is 608-0444, 608-0444. And again, they're located on Melville Street in Vancouver. The website address is drswingle.com if you want to find out more. I'm actually quite amazed by how many calls we've had on an Easter Sunday, but you had a really good point about holidays.
A lot of people are very lonely on holidays. No family around. Any folks that are out there, they can call in about virtually anything they'd like. You know, when we talk about addiction, the last call, very often there is trauma associated with that. And when we do the brain assessment, in addition to the neurological predisposition to addictive behavior, we find the flag for trauma. I'm under the impression that the same genetic predisposition to addiction is the same one that makes us more vulnerable to trauma in terms of developing post-traumatic stress disorder. I have a couple of cases here which might be interesting for the folks to hear. Consider the following examples. These are two individuals that have been traumatized, and one is disabled by it and one isn't. If I can just read this. Emily and Marion both had traumatic experience with dogs. Emily was hiking with her own dog when another dog attacked her and bit her on the wrist. She was terrified. The wound became badly infected and very painful, requiring medical treatment. Marion was walking in the fields when she was terrified by 3 large growling dogs that chased her to a fence. One began tearing at her pants, but their owner fortunately intervened before she was physically injured. Why did Marion, but not Emily, go on to develop dog phobia and traumatic legacy associated with the event when Emily was actually bitten by the dog? So here's a condition in which the individual that had the less dramatic, traumatizing event was less affected than the other individual. Now, the reason for that, of course, is that some people are predisposed with poor stress tolerance. And that's the thing that we find in the brain activity, which brings me to the next item, and that is we can inoculate against some of these things. We can increase your stress tolerance by correcting the neurological condition associated with addiction, poor stress tolerance, predisposition to being disabled by trauma, and so forth, just as we can inoculate against certain forms of depression by normalizing frontal lobe activity, which is associated with depressed states.
When you talk about genetics, can you inherit trauma, or are you simply inheriting the disposition in the brain?
The inherited component of that is the deficiency in brain quieting capability. So there's an area in the brain that is not functioning efficiently. These are the folks that have racing thoughts, thinking of 12 things at the same time, can't find the switch to shut the brain off, can't find peace in their own head, poor stress tolerance. Why are you nodding?
I know exactly what you're talking about. Why do you think I came to see you? I couldn't sleep for days on end. If you have a question for Dr. Paul Swingle, we're going to talk a little bit more about our subject today, which is childhood trauma and post-traumatic stress. This is Experts on Call on CFUN 1410 AM. It's funny, you just mentioned before about all these symptoms about head racing and whatnot. When I first met Dr. Swingle, I didn't even know what neurotherapy was or what brain mapping meant, and so you offered to do a brain map on me, at which time you found all these issues, shall we say. And I did have a terrible time sleeping just because of my strange hours and whatnot. And then so I went through the program, and I think I took about 6 or 7 sessions, if I'm not mistaken. And my sleep has been very, very good since. And I noticed it right away. The difference was almost after the first session. So that's how I got to know Dr. Swingle, and that's why we're here, and we're happy to take your phone calls on any issue you like, including ours of childhood trauma. Let's talk to Betty. Hello, Betty. Thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
Yes, I'd like to find out how successful you've been with very early childhood trauma, i.e. abduction, molestation, and continued terrorization for very extended period of time.
Now, are we dealing with a young child, or are we dealing with an adult with a legacy of that?
No, with, say, a 5-year-old that is terrorized by the individual well past the teens.
Okay. We see a lot of very young children who have severe trauma histories. The reason I asked, of course, is that a lot of adults who have early childhood trauma have very, very serious legacies associated with that, everything from self-mutilation, depression, suicidal ideation, and so forth and so on, addiction, of course. With very young children, there are a number of things that we can do. The first is...
but when they're adults now...
Oh, yeah, yes, sure. That's the more common condition that we see, actually.
Yeah, because if they haven't told anybody, and you go on to develop depressions and so forth over the years, and then suddenly you have a major one, and then they're suddenly citing ADHD features and all sorts of other things, because you're manifesting all these things.
Right.
Only because of this earlier thing you find out by a couple of different psychiatrists.
Yes.
You have some way of dealing with it, put it that way.
Sure. We have a significant population of clients who have exactly this kind of condition of very severe early trauma, everything from satanic ritual abuse, serious parental abuse, and so forth. The procedure is very straightforward. What we do is we do a brain assessment to see what has happened to the brain in terms of, the predispositions to these characteristics, whether there are any legacies associated with the actual emotional trauma.
I.e., what patterns they are entrenched in?
Exactly, what patterns you find in the brain. So when we correct the brain activity, then you're going to have an emotional reaction to that because we're releasing the memories and the emotions associated with the trauma. The good news is we're engaging the most efficient psychotherapy on the planet because you're going to be doing it yourself, or at least a lot of it yourself. You'll have more meaningful psychological dreams. You'll be more mindful of it, but in a very productive kind of way. And then what we do is some psychotherapy or emotional release procedures or behavioral therapy to help you process those things that you're struggling a bit with. It's an extremely efficient system.
Now, would there be somebody, especially if no one was ever told of this, and, the terror continued for their entire life?
Yes.
A neighbor, somebody who lived there. So there would be a psychotherapist of some sort to help go through this period because it's highly suicidal kind of emotions and...
Oh, yes, absolutely. We have registered psychologists on staff. I'm a psychologist myself. For example, if I were the one shepherding this case in my clinic, you would be seeing me for any psychotherapy or counseling or behavioral therapy or any more aggressive brain treatments that were done. You would be seeing technical staff to normalize and correct some of the brain activity that's the impact of the trauma. I can kind of predict the sorts of things that we would find in the brain because we have a lot of research on this in terms of the impact of early childhood trauma and stress on brain development.
Right. I've done a lot of reading about that myself, but I've never found anybody doing anything on it, let alone being able to diagnose anything.
The last thing in the world you want to do is medicate this because all that's doing is sedating you.
Well, Betty, thank you very much for calling. It must offer you, Betty, and a lot of your clients and patients hope that they know that something can be done and that it can be fixed permanently.
Yes, people are dramatically relieved when we do some of this work. We can show them in the brain where the impact of the trauma is, and then we can show them how it's starting to be corrected. And usually after a session or two, they know they're on the right track.
It was probably 2 sessions when I realized something's different, and you brought up the dreams. The dreams became very weird, but very memorable. Yes. And I still remember my dreams quite a bit. Let's take some more phone calls in just a moment as we are talking with Dr. Paul Swingle from Swingle & Associates. His number, 608-0444, 608-0444, drswingle.com. You're listening to Experts on Call. This is CFUN 1410 AM. I'm your host, Peter Shedd. We've taken a lot of phone calls today on this Easter Sunday, and we appreciate those calls at 280-CFUN, 280-2386, and hopefully they can help you as we talk about all sorts of different issues associated with your brain. It's All in Your Head is the name of the program. As we turn to George. George, thanks for waiting. You're on with Dr. Paul Swingle on CFUN 1410 AM.
Hi, good talking with you, Doctor. A question that I've been thinking about. There has been some early childhood trauma. At the age of 8, there's been a death in the family, actually, the father, to be precise. And I'm not sure if addiction is perhaps a symptom of that, the childhood trauma in relationship to the death. Is there anything that can be done about that, in the sense that I heard you talk earlier about treating addiction and that perhaps this could be something that could be dealt with?
Yes, definitely. We often find that a lot of individuals that have addiction problems also have trauma histories. And what we do is have a look at the brain, see where the inefficiencies are, see the ones that are genetic and the ones that are an impact of experience or trauma, for example, and correct them both. If there is something associated with the trauma, then there's going to be some emotionality to deal with, and we either deal with that in counseling or you deal with it as you had mentioned in your dreams. But we treat a lot of folks with these kinds of conditions. And
now, does this involve medication, or what would you suggest, or what route do you people take aside from brain mapping?
George brings up a great question. We haven't talked about neurotherapy since the beginning of the show, but medication, no, and neurotherapy, yes. Maybe you should explain just what it is again.
Sure. What we do is we have a look at the way the brain is functioning. We look at the brain waves coming from the brain activity. And we're looking for areas of inefficiency. And the brain tells us everything in terms of areas associated with predisposition to addictive behavior, the legacy of trauma, depression, and so forth. And then we correct them. And the way they're corrected is referred to as neurotherapy. We don't use medications at all because basically they just sedate the problem. And when you're through with the medication, you still have the problem, if not the addiction to the medication.
Right.
Neurotherapy, there are 3 general classes of neurotherapy. The first is neurofeedback, the one we were mentioning earlier, in which we set it up so that when the brain is doing what we want it to do, the person will hear a tone or see something move on the computer monitor, and it's telling them about an activity they couldn't possibly feel, but they make use of that information to learn how to self-regulate. The second class of treatments are the brain drivers. There we measure a particular aspect of brain functioning. Based on that measurement, we stimulate with light, sound, microamperage stimulation, EMF fields, and so forth, to nudge the brain into more normative functioning.
So is this something like an electrical conditioning?
No. For example, if we're trying to increase flow frequency in the back of the brain, anytime the brain is not producing an adequate amount of brain activity in that region, we would electrically stimulate with a very, very mild electrical pulse. You wouldn't even feel it. We'd stimulate a particular acupuncture point on your wrist. And what that does is increase that slow frequency in the back of the brain. And then we revert back to the neurofeedback so that you're self-regulating it. So we're kind of helping you along with the self-regulation.
So say after a treatment or two, you can actually stimulate it yourself as opposed to coming in for an office treatment.
Well, after a few treatments, the brain starts to normalize, and that will be your standard state. You're not going to have to do anything to do that.
Well, appreciate your info, and we just may give you a phone call.
Okay.
Hey, thanks a lot, George.
Thanks very much.
Let me give you the phone number, too. It's 604-608-0444, 604-608-0444. Dr. Swingle's right downtown on Melville Street. Very important to note there, this is not electroshock therapy that we've heard from the 50s.
No.
This is totally, you don't even feel it, you don't even notice. And I quite enjoyed, personally, the harmonics and the light therapy the most because it was so relaxing. And just to give you an example of what it feels like is, it feels like if you're lying on your back with a tree above you and the sun is kind of dancing through the tree leaves. That's kind of what it feels like when you do the light therapy, which I really quite liked. Hey, we've got a whole hour behind us that has been very fascinating. A lot of great phone calls today. We didn't get a whole lot more into the childhood trauma, but there were some questions about it, and that's okay. You don't mind that.
Not at all. Not at all.
It's what you do. And here again is the telephone number and the address. By the way, it's 1190 Melville Street. Dunsmuir becomes Melville. It's just before Pender Street there. 604-608-0444 for the clinic. And if you want to find out more about Dr. Swingle, the website address is drswingle.com, and Swingle is spelled Swing-L-E, S-W-I-N-G-L-E. It's been a pleasure. Hope you have a great Easter, and don't eat too much chocolate. And we'll see you again on May the 14th when your topic will be
learning and attention problems in children.